Hi, I'm Emily. I'm going to be your nurse today. Can you verify your name and date of birth?
Maggie Thomas, 11/27/2001.
Perfect. So at this time, I would perform hand hygiene. I would provide privacy for the patient. I would raise the bed to a comfortable working position. Raise the opposite side rail and provide a call light for the patient. All right. The patient is sitting on the edge of the bed. Posture is erect. Mood seems to be happy, and speech is clear. Weight is proportionate to the height, age, and lifestyle of the patient. Do you have any pain today?
No.
All right, patient denies pain, and the patient is oriented and alert ×4. All right, so at this time, we'll be doing the head to toe assessment. I'll just be starting from the tip of your head to the tip of your toes. If you at any point feel discomfort or have any questions, just feel free to ask.
Okay.
Alrighty, so I'm going to start with your hair. Hair is brown, smooth, and oily. Back of the head and by the ears. There is no signs of parasites, lesions, or infections noted. I'm going to move to your skin. Skin on the face is warm, smooth, dry, and pink. Face is symmetrical, normocephalic, and proportionate to the patient's body. Now, at this time, we're going to do some facial expressions. If you can puff up your cheeks and blink and smile real big. All right, facial expressions are symmetrical. Now I'm going to do your nose. All right, nose is midline. There is no signs of displacements or enlargements. Do you have any tenderness?
Nope.
All right, there's no signs of discharge or flaring of the nose. And now I'm gonna shine a light. All right, there's no redness, swelling, discharge of the nasal cavities, and patient has denied all pain and tenderness of the nose. All right, at this time, I will be doing your eyes. So the sclera and conjunctiva are white in the eyes with no lesions or redness noted. The pupils are black and about size 5, and they are round and symmetrical on both sides. I'm going to shine a light again. Pupils are reactant and accommodate to the light. So now we're going to play a fun game. If you can just follow the pen light for me. Perfect. All right, now the tip of my pen to the tip of my ear, and on this side. And way up here, and way down here. Perfect. All right, nice job. And at this time, I will be looking at your ears. There are no signs of lesions, discharge, pus, or blood in the ear. Is there any tenderness?
Nope.
All right. Ears are elastic and symmetrical and proportionate to the body and pink. Now I'll be looking at your lips. Lips are full, pink, and smooth. And just smile real big. Teeth are white and intact, and gums are pink. Now say ah. Tongue is bumpy, pink, and moist. Buccal mucosa and oropharynx are pink and smooth. Uvula is mobile and midline, and tonsils are 1+. Alrighty, at this time, I'll be assessing your hands and arms. All right, the skin is smooth, pink, warm, and dry. Fingernail beds are clean and well kept and pink. Cap refill is less than 3 seconds, and turgor is immediate. So I'm gonna have you test your muscle strength, push and pull and squeeze. Perfect. Now we're gonna do some range of motion. If you can flip your wrist. All right, and you're gonna go up, out, and side. So muscle strength is strong and equal bilaterally, and full range of motion of the shoulders, elbows, and wrist. So at this time, I will be doing brachial and radial pulses if that's fine. All right, brachial pulses are 2+ and equal bilaterally. And radial pulses are 2+ and equal bilaterally. All right, so now I'll be moving on to your chest. I'm just gonna assess for some breath sounds, so just give me some deep breaths in. Alrighty, perfect. So breath sounds on the anterior side are clear to auscultation. I'll be listening to your heart sounds. This is aortic, and pulmonary, and tricuspid, and mitral. And on the bell side, I'll be listening aortic, and pulmonary, and tricuspid, and mitral. Alrighty, so heart sounds are regular with S1 and S2 noted, and there are no extra heart tones or murmurs noted. And now at this time, I'm gonna listen to your apical pulse for 1 full minute, if that's okay.
Yep.
All right, apical pulse is 78 beats per minute. So now at this time, if you can just flip around, I'll move your pillow for you. Sorry, you're good. And I'll assess your back. All right, so the back, the skin of the back is pink, warm, smooth, and dry. The spine is straight and midline. I'm gonna compress on both sides. Breathe in for me, and breathe in again. All right, posterior respiratory excursions are equal bilaterally. So every time you feel my hand move, just say 99.
99, 99, 99, 99, 99.
All right, perfect. So posterior vocal fremitus is equal by lap. All right, let me know if you feel any tenderness.
Nope.
All right, the patient denies CBA tenderness. And at this time, I will be listening to your breath sounds again. So every time I move my stethoscope, just breathe for me. All right, perfect. So breath sounds on the posterior side are clear to auscultation, and respirations are even and unlabored. So if I can have you just lay down a little bit for me, I'm going to assess your abdomen. You're so tan.
Thanks.
All right.
Kind of got poop, so don't press too quick.
All right, so just touch your stomach. Skin is pink, warm, smooth, and dry. And listen. It's wild right there.
Dude, yeah, I got poop.
All right. Vowel sounds are normoactive in all 4 quadrants. There was no bruits noted upon auscultation. I'm just going to feel your stomach. Do you have any tenderness?
Nope.
All right, no tenderness noted. On light palpation, do you have a history of urinary retention?
No.
All right, so I'm going to differ palpating the bladder at this time. So I can move this back up for you.
Thanks.
And I'm going to assess your lower extremities. So skin on the legs is warm pink, smooth, and dry. Legs are shaven, and toenails are trimmed, clean, and cap refill is less than 3 seconds. And now we're going to test your muscle strength. So push and pull back and twist in and out. Perfect. All right, and There is no signs of edema on the skin. And now we're going to test range of motion. If you can bend the leg up, out to the side, back up, and down. Same on the other side. Perfect. All right, full range of motion on the lower extremities. I'm going to feel for your popliteal pulse. All right, popliteal pulse is 2+ and equal bilaterally. I'm going to feel for the posterior tibial. Right, 2+ and equal bilaterally. And dorsalis pedis pulse. 2+ and equal bilaterally. All right, so that sums up the majority of the head to toe assessment. So if I can have you just get up and walk to the edge of the room. Perfect, so gait is steady, and that sums up my head to toe assessment.